In India, coronavirus cases have surpassed 5 million and more than 82,000 people have died. Health experts warn that the fatality rate could rise as restrictions ease. Authorities have so far ruled out imposing a second countrywide lockdown. India, home to 1.3 billion people, has reported some of the highest daily case jumps in the world. It's expected to overtake the United States as the country worst hit by the pandemic within the coming weeks. Joining me now is DW's India correspondent Nimisha Jaswal from Delhi. Nimisha, India's coronavirus cases, as we've just heard, have surpassed 5 million. That's the second highest in the world after the US, yet the deaths are still comparatively low. Why is that?
Well, Gerhard, there's still scientific investigations going on to confirm what exactly is the cause of this, but experts have put forward theories. One is that India's population is a young one, much younger than when compared to developed nations which were much worse hit, such as Italy. In addition, there's also a theory of cross-reactivity. This basically means that India's population and other developing countries' populations have been exposed to other coronaviruses, which has actually allowed these populations to fight off this coronavirus in a better way. Of course, critics say that the fatalities may be undercounted, so we should not focus that much on the fatality rates and the relative success India has had in keeping deaths down.
Well, we're hearing that oxygen supplies are running low in India. Can you tell us more about that?
Yes, Gerhard. So oxygen basically across India is supplied by approximately 500 factories that distill and purify oxygen and supply it. In the past, about less than a fifth of this was being used for healthcare, and the rest was being directed to factories to power blast furnaces, for example. However, now with the caseload rising dramatically, the demand for oxygen from the health sector has gone up dramatically as well. Now, over half the oxygen India produces is being directed to healthcare, but there are unlock phases in place in India, so the factories are firing up again and also demanding oxygen. It's almost a case of lives versus livelihoods, and India urgently requires to ramp up its oxygen supply dramatically.
Well, India's government has rejected a second countrywide lockdown and is continuing to lift restrictions. What's the public feeling there about this strategy?
Well, despite the frightening numbers and the grim milestones we keep arriving at in India, Gerhard, the people actually agree with the government that another lockdown is unlikely to help. The government has said that while people must continue to take precautions, we must learn to live with the coronavirus, and the people seem to agree. India saw one of its worst GDP quarterly contractions in the last few months, and there are serious concerns about the massive impact the 2-month complete lockdown we saw in India has on the economy already. And people, as well as the government, say that we must power through, live with the pandemic, and try our best to ramp up infrastructure as well as support in developing a vaccine.
DW's Nimisha Jaswal in Delhi. Thank you very much, Nimisha.